Um, so I've been asked to talk about barriers. And so barriers to data and research on Asian American and Pacific Islanders. And the way I want to do is think about it first conceptually and also have a vision about where we're going. It's hard to talk about barriers if we don't know what we want, what we need at the very end. And so one is conceptualizing barriers. So barriers are clearly just material obstacles, impediments to what we want to get done. In the case for this convening, it is the type of research that we need so we could really identify and develop effective and progressive actions, strategies, policies, and programs. That's the final prize. That is, how do we use and generate information and knowledge that really makes us effective social agents for change? And to understand that, again, what are the barriers? I think we need to think about what is it that we need as a whole, as a field, not necessarily as individual researchers or individual areas. And let me just start off by saying that we have different types of research that are all legitimate. We ought to be vested in basic research. And what I mean by basic research is to develop conceptual and theoretical knowledge. That's important to understand how our society functions. And without that, we just have data and maybe just information. We also need to do applied research. That is to study specific problems and with the purpose of identifying actionable solutions and evaluating interventions. I think one of the things that makes us very different, the gathering here, is that we are social scientists, we are applied scientists, but we're also social scientists, applied scientists that are not just interested in the phenomenon. We're interested in identifying how we can intervene, how we can make a difference in terms of where we're going and where we end up. And we also need the type of research that essentially gathers and synthesizes information at the practice and at the programming and implementation level. Again, that's part of our desire to think about action and intervention. And clearly, these three types of research are not distinct. They overlap, and they should inform each other. There are some common challenges I think we all face in terms of doing this type of research. One is that we need to understand that the phenomena outcomes that we're concerned about come from and are produced by very complex systems that operates with multiple causalities, and that's operating at different levels. And we're not bounded by any particular discipline. Many of us are trained in a particular discipline or within a particular professional area, and that's fast, and that's great. We need that depth of knowledge. But when we confront the real world and the real problem, we soon understand that, for example, economic, social, political, psychological, and other factors, structures, and forces really shape the outcomes. If we are just bounded by our discipline, we'll probably be blind to those factors that are important to understand how we intervene. And these forces, these sort of phenomena, operate at different levels. You don't need to go very far in terms of your research to realize that these things operate at the individual levels. They involve families and small groups. Neighborhoods and communities are forces that can help or impede in terms of what we want. Institutions or organizations are very key to these outcomes, as well as where we live, places, regions, or even nations. And given this complexity, there's also other complexities. What we're looking at tends to be very dynamic. And what I mean by that is history and change matter. It's hard to study many of these things without realizing that we really are studying things that occur over times, multiple time periods. These systems are nonlinear. And what I mean by that is quite often what we do at one stage feeds back and affects what happens. They're also path dependent, and we need to understand how that gets played out. They involve enormous variations across groups, locations, and periods. And so what's true, particularly when we do applied research and look at a particular problem, what we learn in terms of one case study may or may not be applicable. And therefore, that variation is a huge challenge for us to study these problems. And these messy challenges, I have to say, these messy challenges are not unique to Asian Americans and Pacific Islanders. But in some ways, I think our challenges are much more daunting because of the ethnic diversity, language and culture, class, regions. The diversity within the AAPI communities and populations is so huge. I've done research on African Americans and Latinos also. And again, there's complexity there, but not the level of complexity that we face in the Asian American Pacific Islander populations. I just want to give you some examples about what I mean by complex issues. And these are issues I worked with my colleagues on. For example, in the environmental area, we're trying to assess the impact of eliminating toxic chemicals, what's called PERC, on minority communities and dry cleaners. This is sort of an environmental justice issue. Why is it a concern to us? Partly because of our communities, but also because, like in Los Angeles, half of the dry cleaners are Koreans. We have a divided concern here. That is, making sure our communities are not impacted by making sure dry cleaners, Korean dry cleaners, are not disproportionately impacted. To do that, you need complex data to understand the phenomenon as well as over time. Health is another example. The obesity crisis in specific populations and groups. To understand that, we're talking about how individuals behave, how families affect that, how neighborhoods affect that, either through resources, certain social networks and values, or through the lack of, for example, good food outlets. And how do you sort of integrate that into your analysis? I'll skip the other two, because I want to move on. So the data that we really need data, for example, to understand the magnitude, the nature of the problems that we're facing. We also need data, and this is, again, a plea to understand that we have research at different levels. We also need data to enable us to understand the relative importance and the path of causal factors. It's one thing to identify and make known to the public that there are problems that we face, problems that as a society we ought to be concerned about. It's another thing, and I think this is one of our unique roles as social scientists, is begin to understand the causal factors with eye towards understanding from that complexity of causality, where do we intervene? Where do we have leverage points? We also need to have that sort of data to monitor and assess outcome. Again, our concern is not just basic social science. If we want to intervene, we need to understand whether our actions make a difference. And if they make a difference, how do they make a difference? If they're not making a difference, how do we understand they're not making a difference and go back and redo our policies and programs? And clearly, we need that type of data that's ethnic, location, time-specific enough for us to unravel these causalities, to monitor things, to understand the magnitude and nature of problems. Sometimes I like to imagine the best data set I could get a hold of, okay? And so I think we all sort of have that dream every once in a while out there. And so, to handle these problems I just talked about, the complex problem, clearly here's what I want. I want detailed data that's at the micro level. That's longitudinal. That's a combination of administrative files, proprietary data, merged with project-specific surveys and qualitative data that we collect, and merge in the census and governmental data. So we have this massive data set that we can really use for all that type of research. And that involves, for example, working with Dun & Bradstreet data. If you do city planning parcel data, if you do economic work, clearly survey minority-owned businesses, the HMDA data for housing, and so forth. And so we'll have this wonderful ideal data system. And the ideal data system is created from ideal data partnership. And what I mean by that is that we work with all the appropriate stakeholders, including the federal agencies, in terms of collecting data. So we have adequate coverage of small groups and areas that's linguistically and culturally appropriate, the way we gather information, that we assure confidentiality and therefore trust for those subjects that we have out there. Yeah, and data, so it's not just collecting the data, but it's also data enhancement and the distribution of access. And data enhancement, what I mean is how do we bring together all that data from different sources into this sort of wonderful data system that I have in my mind in terms of what we want to do. And clearly, we want to have usage in such a way that makes maximum use of it. And what I mean by that is I learn from my colleagues. I learn from those in the public sector about how they collect the data, so I understand the limitations and so forth. I learn from my colleagues, from my students, about how best we make use of that data, and that's an exchange of information ideas. And so that's the partnership that we want. And actually, in some ways, there are good models of how we've done that. And I think models are important. It's quite easy to identify problems and talk about, you should do this, you haven't done that. But it's equally important to think about models, because to move forward, we need to have concrete examples. A good example is the work between the National Cancer Institute and CHIS, the California Health Interview Survey, and collaboration in terms of developing both the survey instrument, evaluating whether CHIS is adequately and representatively covering the Asian population. It also helps that the National Cancer Institute pump money into this. So that's another part of the partnership. Another good example I've been intrigued by, we talked a little bit about that, is the Longitudinal Employment and Household Dynamics program. There was a small pilot project where we actually linked that administrative longitudinal data on employment and businesses to the 1 in 6 sample from the 2000 census at the micro level. That is the ability to link survey data to administrative data and use that information to study things. I think there are other examples about how we could do this. Did you know, for example, that the Native Hawaiian homeland geographies were put into the census as official geography out of the 2000 efforts, working with the Census Bureau, telling them that it's important to have that geography, telling them that technically it's possible, actually providing the boundaries to them to show that it's possible. But in the end, we now have, as official geography, Native Hawaiian homelands. And so partnerships are very important, and certainly we have examples of how that could work. Unfortunately, these examples are more exceptions than the rule. But again, we could learn from it, but we identify huge gaps. In my opinion, clearly there is a lack of in-house Asian American Pacific Islander expertise in most federal and governmental agencies. My discussion with many of these agencies, I also get the perception that it's not important for them to have that expertise. I think that is too bad, because I think we can learn a lot by making a priority within these agencies to get that expertise. It could be through hiring, or it could be through partnerships, deep partnerships in terms of exchanging ideas and information. I think we need to have better linkage between our researchers that are university-based in the academy with public agencies. WHIAAPI sometimes works and doesn't work. It's more ad hoc in terms of linking researchers to the Bureau of the Census. Certainly we could learn a lot by where it does work. Quite often some of us get brought in as consultants, so when there's a pressing issues on AAPIs, the agency will bring you in as an ad hoc consultant, but that's ad hoc. I mean, that's all the limitations of that. I think we are also guilty. I mean, it's easy, again, to point our fingers at public agencies. I think we're also guilty because within Asian American Studies, ethics studies, applied and policy research is really underdeveloped. It's an area that we have not trained a lot of our students in. It's not an area that's core to what we've been doing. So we have to look inwards and figure out how we do that. As a result of all these sort of barriers and problems, there's numerous problems that you see in the handout in the package you got. The problems of small groups, the problems of access, and so forth. So what can we do? And actually, what I want to do is not talk about specific recommendations. I think that will come up throughout today and tomorrow. But I think we should think broadly. One is that I think we need to think about institutional and organizational change. And what I mean by that is, one of the things is really building bridges across academic and the academy and the public sectors. Building bridges across silos that exist within the academy and within the public sector. That is, how do we encourage communications and partnership that bridges across different areas. If we don't do that, then it's hard for us, for example, to pull in the economic data with the health data. It's impossible for us, how do we pull in the housing data with some of the data on environmental impact and environmental risk. There's another broad issue we ought to be concerned about is resources. And this is not the best of times to think about resources. I think we still should continue to demand a fair share of the resources. To what degree resources are put into studying diversity, differences, and so forth, we need to have a fair share. We need to be at that table in terms of the resources. But I think there's also a burden, because if you have limited resources, there are two things you could do. One is greater efficiency about how we use our resources. It is a pity, for example, how often we reinvent the wheel. That is, when you start on a project, that I notice that we go through the same process of rediscovering things, about coming up with the same methodology and so forth. That's a huge waste of your time and resources. And so we need to think about changes that allow us to have greater efficiency, and part of that is what economists call economies of scales. I have to plead guilty. I'm an economist by training, so I think of the world that way. But I think there's some truth in thinking about greater efficiencies in economies and scales and how to achieve that. And we also need to somehow overcoming the reinventing wheel really means how do we develop a body of knowledge and practice that's readily out there. And so we have access to that. Now, we have not done that very well as a field in terms of developing that systematic, codified knowledge base out there. And so I think those are the larger challenges that applies to any agency or any of these areas. Clearly, they're not to preclude the fact that when we talk about health data, business data, immigration data, any specific data, that there will be specific and unique problems. And we need to think about how we fill out the details. If you don't have the details, we won't make much progress. But at the same time, I encourage us to keep our eyes on the prize. That is, how do we bring about a larger change, institutional change, practice change, that allows us to move forward and move the field forward. I would also say that although I said I have my ideal vision about that data set out there, that detail, micro level, longitudinal, place specific, time, multiple time, and all that, there's much to be said about what's always been beaten into my head. That is, don't make the perfect the enemy of the good. I think what we can make out of what we do today and tomorrow is think about how do we make incremental progress in such a way it moves us forward towards that final vision about where we want to be. And so that's my final comment, and I want to thank you for listening to me.
Thank you, Paul. You can all see why Paul has so many students, so many followers, because of his genuine concern, and that it comes across, with his work with the students and researchers and in all the federal agencies. So we're, again, very grateful for the work that you're doing. He's our motivator out there. And so I'd like to now invite Nadia to speak about, to further go into the details. We're going to save the big gun, Kathy Wallman, for the final remarks, as everyone's, she's got a lot to say, we know. And so Nadia, exactly what Paul is talking about and why we're doing this work, why we're doing this research is to be agents of social change. And I think Nadia's work is exemplary of that because she's worked with organizing taxi drivers, working with laborers in New York City. Her paper is actually in the packet, which was just published. So it was just published in November, right, last month. So, and it goes into the details of this very issue. And talking about 2 degrees of separation, Deanna Zhang, who's here, she's worked very closely with the initiative, and she's now at DOJ. She's one of the co-authors of the paper, and she's at DOJ's core office, and we're really lucky to have our leaders in positions of leadership in the administration. And so a leader in the field upcoming is Nadia Islam, so I invite her to the, I don't know if you wanted to stay there or come up here. Okay, okay. You downloaded it already?
I did. Good morning, everyone. Let me just get set up here. Okay, so I'm really pleased to be here today. Again, my name is Nadia Islam, and I'm the Deputy Director of the NYU Center for the Study of Asian American Health. We are a National Institute of Health funded research center of excellence, and really pleased to be here representing the center and to be given this opportunity to share what we think are some very important issues regarding methodological challenges and some potential solutions for the collection, analysis, and reporting of data. So how do I do this slideshow? Okay. Yeah, okay. So I think Christina mentioned that this presentation is based on a paper that was very recently published, so it was very fortuitous timing with this event. And I would like to just start by acknowledging my co-authors, including Deanna, who's in the room, as well as Dr. Simona Kwan, Suela Khan, Margarita Rowe, and Chowtrin Chevron. So why is this issue important? I was told actually that the audience would be people who are unfamiliar with this issue, but clearly that's not the case. I see many friendly faces, familiar faces, and really leading experts in these issues. But as we know, despite the rapid population growth in our communities, we remain understudied and, for the most part, poorly understood, particularly in terms of health disparities, which is my area of focus, but across so many other social and economic indicators as well. In terms of data collection and reporting, the Institute of Medicine and National Research Council have issued recent reports calling for data collection on patient race, ethnicity, and language use as a strategy for actually improving health disparities. We do know that there are limitations to what we currently have available in terms of the published literature. In a 2003 study that's, I think, very well known and cited now, Dr. Ghosh found that very small numbers, 0.2% of federal grants were dedicated to Asian American health disparities. 0.01% of publications were dedicated to looking at Asian American groups. Now, I will say that since this is a 2003 study, since this time there have been huge strides, particularly from the federal government, in terms of funding initiatives and research studies regarding Asian American health. I think the initiatives that I'm a part of is a great example of that, but many that you all in the room are a part of as well. We know that in terms of what is available in the published literature, there are issues with the quality in terms of aggregated data, small sample sizes, inconsistent definitions of Asian Americans and Pacific Islanders. Much of the literature that we have is unevenly distributed by geographic region. So what I'm going to do today is really kind of set the context, I hope, for the remainder of the conversations and discussions that will happen during the rest of the conference. I'm going to start off by talking about some of the limitations of large national data collection efforts, and I am going to focus my talk on large national data collection efforts. And then I'm going to go on to present some potential solutions or ideas for how we might address those challenges. So in the paper, we explore several challenges that exist in terms of the collection, reporting, and analysis in large national data sets. This include lack or limited subgroup categorization of Asian American subgroups, inconsistent definitions of Asian Americans, limited data collection in Asian languages, the uneven distribution of geographic representation, small sample sizes and lack of oversampling among Asian groups, limitations to random digit dial sampling methods, lack of implementation of OMB standards in terms of race and ethnicity, and lack of or inconsistent reporting of race and ethnicity data in disease registries, health plans, and hospitals. So this is an overview of all of the challenges that I explore in the paper. I'm just going to highlight a few of these just for the sake of time. So in terms of lack or limited subgroup categorization, if you do a survey of many of the large national federally funded data collection efforts, you'll see that what we have is sort of a patchwork of some surveys that collect some race and ethnicity data, many surveys that report only racial data. And so this gives you an idea. For example, National Health Interview Survey does include ethnic subgroup variables, but only for Chinese, Korean, Japanese, Filipino, Asian, Indian, and Vietnamese. And Haynes, for example, does also collect ethnic subgroup variables, but it's not available in public data sets. A survey like the Behavioral Risk Factor Surveillance Survey, racial data is only available. And then the census we know is a great example of providing very detailed disaggregated data. Another issue is the limited data collection in Asian languages. I'm not going to go over this in too much detail, but we do know that in our communities there are high rates of limited English proficiency. There are many households that are linguistically isolated, and many Asian American families speak a language other than English at home. So clearly this has large implication in terms of data collection when it's conducted only in English. So again, if you do a survey of some of the large national data collection efforts, again, you see this sort of patchwork of some efforts that do employ interpreters or bilingual data collectors, but others that are conducted in English or Spanish only, which will not be helpful for many of our communities. Sorry, go back. So another issue that we explore in the paper are the limitations to random digit dialing telephone surveying methodologies, which many large-scale national data collection efforts employ. Studies have documented that racial and ethnic minority groups are less likely to own a landline than white populations, and in recent years there's been increasing investigation into looking at Asian Americans and cellular phone ownership, and studies have found that Asian Americans as a whole have larger use of cellular phones as compared to landlines. Some of the data that's presented here is a little bit outdated. Recent data actually shows that there's even larger percentages of families that have cell phone only households and do not have landlines. The National Health Interview Survey actually released a report in 2007 and concluded that the inability to reach households with only wireless telephones has potential implications for results from health surveys. The potential for bias due to undercoverage remains a real and growing threat. So if you look at a snapshot of some of the large national surveys, you'll see that many of them are conducted by phone, and I think this is changing recently, but the majority do not include cell phones as part of their sampling strategy. And finally, another issue I just want to highlight is the reporting of patient data. So the reporting of race and ethnicity data within things like disease registries, hospitals, and health plans is inconsistent at best or does not occur at all. And some examples that I could highlight include from the National Vital Statistics, which record identification of Chinese, Filipinos, and Japanese in all 50 states, but other ethnic groups are only recorded in 9 states. Another example is the Department of Veteran Affairs administrative data, which contains some of the highest rates of misclassification of Asian Americans. And so I think a gentleman in the audience earlier had asked about the implications for using administrative data in place of census data, and so potentially the implications would be profound. So I think Dr. Ong said, it's great to talk about challenges, but that doesn't really get us anywhere unless we can think of some constructive solutions. So I'd like to offer a few examples and potential solutions for disaggregated data collection, analysis, and reporting based on the work of many of you here in this room, as well as some work that we're doing at NYU. So some of the examples I'm going to highlight include pooling data, using large-scale national and state-based epidemiological studies, creating clinical epidemiology data repositories, and using other innovative community-based or alternative sampling strategies. So in terms of pooling data, in national studies that have annual data collection, data can be combined across several years to yield larger sample sizes for smaller sub-ethnic groups. So some of the benefits of using this approach are that we can increase reliability of estimates for some of the smaller population subgroups. I think Dr. Grove had alluded to this. And it would potentially allow for comparability of Asian American subgroups to other racial and ethnic minority groups. Some of the drawbacks to this approach are that it does not address limitations related to the data collection strategies in the first place. There are often, across surveys, inconsistent definitions and classification of ethnicity across data sets, and variables may not be consistent across all years, even within the same survey. And then the other challenge, and this is in particular in regards to health research, but as well as other types of research, this pooling data does not enable us to detect trends across time, which is important as well. So some examples of some publications that have yielded some fruitful publications using pooled data include a report released by the CDC in 2008, which pooled National Health Interview Survey data, and a report that was conducted in conjunction with the Asian Pacific Islander Health Forum and the Kaiser Family Foundation, looking at health coverage across Asian American subgroups. This is some of our own work from NYU. We have worked with the New York City Department of Health, which conducts an annual community health survey and does oversample Asian Americans. Despite the oversampling of Asian Americans, in 1 year, the sample sizes are too small to conduct subgroup comparisons. So we have worked with the city to analyze data, pooled data. We're also doing a similar analysis with the Massachusetts Department of Health that conducts a similar data. So we're hoping to do some comparisons across New York and Massachusetts. So another suggestion is to implement national or state-based epidemiological studies in Asian American populations. And in order, what this would do is to ensure geographic and ethnic subgroup representation of Asian Americans. And so some of the benefits of this approach are that you do have better geographic representation, it allows for disaggregation of data, and the larger sample sizes allows for examination of various, other critical factors impacting health. The drawbacks to studies like this are that they tend to be rather expensive. There are concerns about logistics and feasibility, and these studies often do encounter data collection barriers. And I think the example I'll highlight is probably very well known to many of you here in this room. It's the National Latino and Asian American Study that has yielded numerous publications in recent years regarding the role of discrimination on health outcomes, as well as a whole host of other factors and mental health outcomes. So NLAS, for those of you who don't know, is a nationally representative household sample of Latino and Asian Americans. It was a face-to-face administered survey and targeted Asian American individuals. And there were 3 national origin groups that were targeted, including Chinese, Filipino, and Vietnamese, but other Asian groups were included. So moving on, another suggestion in terms of getting access to clinical data is to implement clinical epidemiology data repositories. Some of the pros to this approach are that we can get clinical rather than self-report data on morbidity, which is what we usually get from surveys. The data collection can be integrated with community screening and intervention research, and data can inform regional health planning and policy development, and clinical and epidemiological data can be integrated. So some of the drawbacks to this approach are that regional data does not allow for national comparisons. These types of repositories that are created are often based on convenient sampling strategies, so there's a question about generalizability. And again, there are cost and feasibility issues. So an example I'd like to highlight is from some of our own work at NYU, and my colleague, Dr. Henry Pollack, will be speaking more about this later on today. But through the Asian American Hepatitis B program, community-based screenings were conducted in New York City in collaboration with community-based partners across a range of Asian American communities, and over 10,000 individuals were screened for hepatitis B, and all screened individuals completed a 30-item questionnaire assessing demographic characteristics, as well as knowledge and behaviors related to hepatitis B. And some of the findings from our study were published in MMWR. So the last example that I'm going to talk about as a potential way of addressing some of these data challenges are to employ more innovative community-based sampling strategies. So community-based sampling strategies such as snowball sampling, respondent-driven sampling, venue-based sampling, or street intercept sampling can be employed to target harder-to-reach populations. Some of the benefits of this are that it does capture hard-to-reach populations such as new or undocumented immigrants, linguistically isolated groups, very smaller subgroups within immigrant communities. These methodologies usually do not rely on telephone surveying, and when conducted within a community-based participatory research framework, they can often generate substantial sample sizes which allow for the disaggregation of data. Some of the drawbacks to the approach are that these typically are not randomized sampling approaches, and regional data may not be generalizable to the overall population or on a national level. An example of street intercept sampling that we have done at NYU is a part of a larger center grant that we have that's funded from the CDC called the Be Free Seed. It's a National Center of Excellence, the elimination of hepatitis B disparities. And we gathered formative data to inform the development of an evidence-based social marketing campaign to increase awareness of hepatitis B in Korean and Chinese communities in New York City. And we did use a street intercepts methodology, which involved two things. We first conducted an environmental scan of areas in New York City with high population of Chinese and Koreans. And within these areas, high traffic areas and venues were targeted to conduct the surveys. And we designated a marker at each location, and every third person was approached to conduct the survey. So from that survey, we have a sample size of approximately 1,000 individuals. 500 surveys were conducted in the Korean population and 500 in the Chinese. And I just want to focus your attention to, I guess it's your left-hand side. We collected information on telephone usage and cell phone usage within the survey to be able to make the case for these type of sampling strategies. And what we found is that about 30% of individuals in each population had only a cell phone, no landline. So what the implications for that is that we would have missed approximately 30% of individuals that we surveyed if we had not received community input and decided to use this type of strategy rather than, for example, a randomized telephone survey strategy. So some of my recommendations and conclusions, not mine, recommendations and conclusions of all of the authors on our paper include a whole host of things. Implementing and collecting Asian subgroup ethnicity across data sets I think is critical. Standardizing data collection and implementing OMB standards, and to try to avoid the classification of Asian Americans by country of birth, since this is not always an accurate representation of ethnicity. In terms of data collection, providing bilingual interpreters for data collection is going to continue to be important. Working with community-based organizations to collect the data, the census is a good model of that. And when we're using telephone-based strategies, utilizing language lines for telephone surveys, which some of the large national data collections do use. We should continue to support efforts to oversample data across geographic areas and support sort of the range of factors that are related to that. We need to advocate for more funding for oversampling, that oversampling happens on a continued basis, et cetera. Employing innovative sampling and analysis methods, including cell phone only households and telephone-based surveys are two other important areas. And finally, I think something that many of our presenters have alluded to are to really to continue to try to coordinate across research sites and have multi-site studies to create data repositories across geographic areas and to pool and link data sets as much as possible. So I'm going to end with that, and I'll be happy to take any questions at the end.
Thank you, Nadia. As Paul said, I think only in this room can you talk about your dream data set and really dream about it. Well, here we also think about the dream abstract, and basically Nadia's paper was that with her colleagues because it just outlines the problem, and it's published now so that we can forward it to others, and it provides very clear examples of all the federal data sets. So we really appreciate it. And I just want to take this time to, if our federal partners could raise your hand so that we can identify you. So you will be, thank you very much, praise them high. So everyone should know that these are our friends who are here today, and they're taking ravishly their notes, I can see, on what they're going to bring back to their agencies and to implement into their agency plans and improve data collection for our community. And so we will wrap up with our the person who gets a lot of questions. I actually worked at OMB for 7 years, and if I hear about this directive one more time, I told Kathy that you just need to put an end to it right now. And she is the perfect person to talk about it because she's been there since the beginning. You have her bio there. She is the queen bee statistician for the federal government. And anything that happened at OMB, that was related to statistics, in the federal agents, you had to clear it through Kathy and her office. And so we're really privileged to have her with us. But not only that, but we talk about as the initiative that our goal is actually to become obsolete. And the only way we can become obsolete is if we have change coming from within and it's institutionalized. And the only way we can do that is if we have people in leadership positions who are advocating such change. And Kathy is the perfect example of that. She is an advocate for our community. I know I probably can't use that word with OMB in the same sentence, but I'm going to say it anyway. So without further ado, I'd like to welcome Kathy. Thank you.
Thanks very much, Christina. There's a gentleman who really would like to ask a question of the preceding speaker, I think. And you want to take a moment to do that? If it was me, I would lose it by the time I'm finished. So.
Actually, Francisco, can you?
Yeah.
My name is Francisco C. with NIH, and I work with our co on detail in the Office of Assistant Secretary for Health, and I coordinate the API issues with the HHS. And I'm glad that we have the IDS project, which is one of the organizations with NIH. But I want to address the issue about the collection of the gender, race, ethnicity, language and disability. And there's a working group right now at the federal level that's working on that section 4302. And also regarding the National Household Interview Survey and the NHANES survey, there will increase oversampling for Asian Americans. And these are all contained in our HHS agency plan submitted to the White House initiative. And once it's posted online in their website, we hope you would give your comments on this, because one of the priority areas for us is the data collection.
Thank you very much. Christina, thank you for that very gracious introduction. I didn't know I impressed you that much during your 7 years at OMB, but I'm happy to know that. I do have the responsibility as chief statistician for a number of things in the decentralized federal statistical system, and I'm going to spend about 30 seconds on that part just to put myself in context here. I'm very different from the colleagues to my right and left here in terms of how I spend my days, nights, weekends, holidays, and so on. I was taken with the got data conversation at the beginning today. The American Statistical Association has another T-shirt available that former OMB Director Peter Orszag coveted. You may, if you know Peter at all, you know if there's a data geek, sorry Peter, he self-identifies this way though, so if there's a data geek in our midst, it's Peter Orszag, former OMB Director, but he coveted when I came home from one of our meetings, at statistical meetings, he coveted the T-shirt that said, friends don't let friends derive drunk. So Peter now has one of those. You may know he's a runner, and so he wears it also with care where he's wearing it. But that they think we're weird as statisticians and nerdy and all that kind of stuff. But we have a sense of humor somewhere buried down there beneath. The statistical policy function has been around at OMB since 1939. I'm not going to regale you with stories of what's been going on since that time, but only to highlight that the reason we have this statistical policy coordination standard setting function at OMB is because we have a very decentralized statistical system in the United States, which you are aware of because we've already talked about the different agencies you've tried to work with and tried to have comparable data and so on. Amongst other things in my role at OMB, I do have the opportunity to have a perspective across the statistical system. So when we're talking about budgeting, we're doing a lot of talking about budgeting these days. We're not sure which budget we're talking about anymore, but when we talk about budgets, I do have a lens that looks across the statistical system so that if we need complementary things going on in order to ultimately produce GDP or something, that's usually the easiest example, and I have an economist on my right, so he'll support me here, so that we have the component pieces that we need. So in budgeting, we play a role. We also, Christina alluded to this, I think, have the responsibility and have since 1940, apparently 42, responsibility at OMB for approving every information collection that's promulgated by the federal government. Just to give you scope on that, and by the way, I'm thrilled to see a whole room full of people I don't know. This is great. Sometimes I feel like I'm, with the choir and whatever, and I know very few of you in this room today, so I'm very pleased to have the opportunity to get to know more of you. We have about 8,000 live data collections, information collections in the federal government at any time. Now, that's everything, okay? That's tax forms, that's compliance forms, that's regulatory forms. It's also evaluations and statistics and so on. I would say they probably account for less than 5% of the total burden in any event that we impose in reporting on the American population. But that said, all of those information collections hold a clearance for only 3 years. This is not by OMB directive. This is because the Paperwork Reduction Act and its precursor said that's the way it is. So we in OMB are constantly reviewing information collections that are being promulgated by agencies of the federal government. And if you did some quick math there, approaching 3,000 a year because the maximum approval is for 3 years. So that's very sloppy arithmetic that I just did. But it'll give you an order of magnitude of what we see going through. And it's important to know that we have that role in this conversation only to know that this is a very important mechanism for us to monitor implementation of standards in federal reporting requirements. So that's the link. Why is it important? So I'm just trying to tell you about these other functions of budgeting and information collection review because they're pieces of a puzzle that help us in efforts that we may undertake with you and in addition to with you to meet the kinds of objectives you have. I was trying to think of a word to describe the database that was being suggested by my colleague to my right, and the only thing that came to mind, frankly, was supercalifragilisticexpialidocious, because it's the longest word I could think of. So maybe that is what it is. Wasn't that Mary Poppins or somebody who sort of dreamed around? But the point you made actually, and I was drawing a circle on the table as he was talking because he was coming full circle on what I think is probably, I've been saying this for 20 years, but I still think it's probably the knottiest issue we face in the work that we do, and that is the tension between maintaining the confidentiality. Bob Groves talked about this morning. It's important for people to realize, if they don't know it, that if you set aside the decennial census and the American Community Survey, virtually everything we collect from the American people is collected based on their voluntary cooperation with us. These are not mandatory surveys. The whole ream of health surveys that's been discussed here, but you can iterate that. If we're talking education, if we're talking about the current population survey. Is Tom in the room yet? Tom Nardone, he's supposed to be joining you. Oh, I see his hand. I couldn't see his face. Sorry. Okay, he's wonderful. The current population survey that gives you those famous monthly employment, unemployment numbers, roughly, not exactly, but roughly the first Friday of every month of the year, is a voluntary survey. We enjoy the voluntary cooperation of the American public, in my view, because we promise them confidentiality. So that's one side of this. I was going to say one side of this coin, but then I was drawing a circle, right? So what is the other thing that I personally believe is the biggest counterweight tension is the desire of a very now computer literate society to have the microdata, the detailed information, more and more and more, because it's there and because they have the technology to work with it in ways that when I was on my first IBM 360/65, yes, you know, it didn't look like the laptops everybody has here that they can manipulate the information and so on. But I think this is a huge tension that we face, and we've, you know, we can dream. I dream too. They call me Pollyanna sometimes, not without good reason. But, you know, but I think we have to be alert to those tensions when we ask for things. So I did want to then come to standards, and in particular, the standards that we have for the collection and presentation of data on race and ethnicity, which is the featured reason that I'm here this morning, I think. This standard, I think, is probably well known to many people in this room, apparently. Why is OMB in the standards business? We're in the standards business primarily because of this decentralized system that I mentioned at the outset, and the need to have what I call a common language when we're talking across that system. So that when we talk about industries, or when we talk about occupations, indeed when we talk about metropolitan statistical areas, which is a kind of classification for presentation, not for collection, but when we talk about any of these key variables, if you will, that we're talking about them in a consistent way, so that we have numerators and denominators that match. Take it that way if you want. I call the census the great denominator, and everything we're doing in all these specialized surveys as the numerators, and we need those to match. Data on race and ethnicity was one of the areas where, back in the 70s, that's the 1970s, there's a couple people in the room I know who remember, back in the 1970s, originally, well, it was Caspar Weinberger, who was at the Department of Health, Education, and Welfare, for those who are into history here. He was worried about the comparability of data in education. There was a Federal Interagency Committee on Education, and Caspar Weinberger, as Secretary of HEW, came to OMB at the time. It was in 1974, roughly, something like that, and said, we've come to consensus in the education community about a standard way of asking for data on race and ethnicity in federal reporting that we're doing. Could that be expanded to cover more domains that the federal government inquires about? And so OMB, the same office that I'm at now, OMB took on that role of convening an interagency group to work and see if we could, for the first time, frankly, issue some sort of standard for data on race and ethnicity. That's the well-known Directive 15, Statistical Policy Directive 15. It got that clever title, which means nothing to anybody except people in this room and others like you who know what it is. Anyway, that was issued in the 1970s, and so that served us reasonably well for a decade or two. And then in the early 90s, after the 1990s, after the 1990 census, there was a fairly major, I'll call it, public expression of concern and interest about the way that data on race and ethnicity were being collected by the federal government. And two things really brought this to people's attention. One was the 1990 census, and the other was increasingly parents were filling out education forms for their kids, and particularly at the elementary school level, because when they're in high school and beyond, theoretically they're filling out their, I don't know if they are or not, but anyway, but parents were struck, shall we say, by the what they viewed as the inadequacy of the classification system that they were being asked to use in identifying their kids for purposes of federal funding that was coming through school systems. I'm oversimplifying, but that's basically what it's about. And if you live anywhere, you probably get a form somewhere towards the beginning of the school year or during the summer asking whether there are any kids in the household and what their ages and races and so on are. So that public concern came to us. We had some concerns of our own, frankly, because when we started examining the responses to the 1990 census, there were 500,000 people who were giving us categories that didn't fit. And now we'll eliminate for this conversation the ones who wrote down human for the race. No. I actually have a brother who's 4 years older than I am. And he called me during the 2010 census. Bob knows the story, but he's gone now. He called me during the 2010 census to tell me about this hoot of a person in his neighborhood who was going to write in human in the race thing. I get along pretty well with my brother, but my brother really got it from me in that phone conversation. Anyway, there were 500,000 people. This is not a big number compared to the numbers that Bob was showing you for the estimate of the population, but you can imagine if you looked carefully at those 500,000 responses, they were not distributed equally across different groups in the population and so on. So there were changing demographics in the country, changing immigration patterns. There were a number of both, if you want to call them statistical demographic issues, and there were a number of, I'll call them personal identification issues that drove us to a conclusion in the early 90s that it was time to re-examine the standards we had set in place, and to do that in a time frame that would make any standards any changes that we made available for use beginning with what was the Census 2000. And so for those who don't know the history, I'll just try to say it in a few words. We had what we came to call a three-prong approach to this. We did a lot of research within the statistical agencies. BLS and Census and National Center for Health Statistics, I think I'll call that as probably the three big leaders on this, but National Center for Education Statistics and others were involved in this. But we did research to test various approaches to collecting data on race and ethnicity that were different from what we had been doing in the past and that had been suggested to us by the research community or through our own experience. I'm speaking royally here. I don't do this work myself, but when I say we, I'm talking about the federal statistical community. So prong one we'll call research. Prong two was we convened an interagency committee. I think there were 30 agencies on it, and they were the principal producers and users of statistics on race and ethnicity. So in one sense, you can think about the census as a principal producer or the National Center for Health Statistics, but there were also a number of agencies at that table who really don't collect much data themselves, but depend heavily and constantly on the data that's produced by the system. The third prong of this initiative was what I'll call public outreach. And there were a couple of approaches to that, including putting out a number of calls for public views, ranging from the very open-ended one at the beginning of the process, which was, we're thinking about possibly changing, what would you like to see us do, which did in fact inform some of the research component of this as well, to, as we came along with the research results and started framing where we might be going, we put out a series of Federal Register notices. These, by the way, are all on the website if anybody really wants to become a student of history of this activity. The third thing we did, which was unique in my OMB experience, was to, in terms of outreach, was to host, or to participate in, I should say, a small series of public hearings. And we did 4 of them, and they were not all in Washington. They started in fact, none of them were in Washington. We started in Boston, and we were in Colorado, and we were in California. And then because Senator Akaka and Esther said we had to, we were in Honolulu also for a day listening to the Asian Pacific Island communities, and they actually a number of people flew in, I think, from the other Pacific Islands to participate in those hearings, if I remember correctly. Those hearings, incidentally, were exceptionally informative to our decision-making, and I had a chance to say this to Esther again yesterday, but central to the conclusion we reached about separating out the Native Hawaiian Pacific Islander group from the overall Asian group in our standard at that time, central to that decision was the very compelling testimony we heard, particularly, I still didn't have time to do it, particularly from a gentleman in Hawaii who had presented results on the educational achievement. And it was just, I to this day, and I'm talking a long time ago now, but to this day, 15 years ago, I can remember the aha moment that I personally had when we were doing that hearing. My team over there from the Office of Hawaiian Affairs is still trying to figure out who I'm talking about, and they probably know. But it's in a lateral file in my office. I just haven't had time since I talked to you yesterday to approach that file cabinet. So we issued, based on this three-prong review, we did issue this revision to the standard, which I think you're all familiar with, in October 30th, 1997, not to put too fine a point on it. And that gave us time then to use the new standard in taking the census and then ultimately to phase in the implementation of the standard in what I'll call the numerator surveys, the administrative records, and so on, other programs of the government. Some were faster than others, frankly, and surveys in general did this more quickly than those who had administrative record systems. Now, Bob Groves and I are having a big discussion about how we all got stuck with this word administrative record systems, and I know how I got stuck with it. I got stuck with it because when we were trying to think of some comprehensive composite word to describe data that are collected for regulatory purposes, data that are collected to administer a program benefit, data da-da-da, we, whoever we are, started calling them administrative records. Systems we need to administer federal programs, I think is probably the derivation if I had to make it up in retrospect here. So when we talk about administrative record systems in education, for example, we're talking about a system where the local education agencies and the state education agencies are the principal keepers of those records. And we're aggregating those and bringing them up to Washington, if you will, via states and so on. But school systems have to change their records. Similarly, employers, and you can think about the Equal Employment Opportunity Commission here as a key example of this. Employers have to change their record-keeping systems when we introduce a new standard. They have to do this too if we introduce industry classification or occupation. They have to change their record systems. And they would argue that this is expensive and it takes time to do that, and I think that's a legitimate statement. So they ask for lead time when we're going to make a change like this. So if the administrative records system-based systems seem to be lagging behind what the survey people were able to do in implementing the standard, that is a correct observation. I think we finally got them. And what I mean by that is that the two areas that I feel in general, there may be specific exceptions, I'm sure your research shows this, but in general, the two areas that were slowest to implement these standards were in the area of education and in the area of civil rights, well, maybe civil rights, EEOC is really what I'm talking about here. The compliance reporting that industry has to do, and industry also includes educational institutions reporting on their teachers and so on. It includes hospitals reporting on their staff. Any entity that has to report to the EEOC, which means a lot of them, they were last in line, if you will, in terms of implementing the standard. I would say, not because we weren't pushing. I mentioned this reporting information collection review process that we have at OMB, every single time these guys came in for any sort of renewal or whatever, we were saying, when are you going to, do it? And, terms of clearance on these things saying, you can only have a 3-month extension or whatever, because we're not giving you 3 more years, until you get with the program here. I would like to emphasize 3 things in talking about the standards. One, these standards don't tell federal agencies to collect data on race and ethnicity. They say, if you are going to collect data on race and ethnicity, then you should use these standards. This is a distinction that's very important for people to recognize. So I don't have a standard out there that says to the Federal Communications Commission, sorry, you identified yourself earlier. I don't have a standard at OMB that says, FCC, you have to collect data on race and ethnicity. But I do have a standard that says, FCC, if you're going to promulgate a form, an information collection from the FCC that asks for data about race and ethnicity, then you got to be consistent with these standards. Okay, so that's principle number 1 that I would like to underscore. Principle number 2 is this is a minimum standard. It does not say you can or can't collect greater detail if it's relevant to do that. It absolutely does not say that. But it does not prescribe greater detail. Because, in general, that probably depends upon what your survey is, what your information collection is, whether it makes sense in particular geographic area, maybe. Depending, I don't know. I mean, I don't know all the answers, but I'm just saying it needs to be thought through. Now, it could be useful if an agency says they really do need to collect greater detail on the Hawaiian Native Pacific Islander, population, that they do it consistent with whatever categories we use on the census, if those are right, by the way, as census advisors, please, But to the extent, let's say, to the extent that the census has disaggregated some of the larger population groups for purposes of census collection, if it makes sense and has utility, I'm going to say that word a lot of times, for other surveys or information collections to be doing it, then probably the census model or the best or whatever. But I think it's unlikely that OMB would issue more detailed categories. We might refer people to places and say, this is good practice. We might do a best practices sort of thing with help from you guys. But I don't think we're going to say, as long as we have a minimum standard, you heard the discussion already about suppression and so on. We have these problems. And we do have to think of ways to get these data out in better way. But collecting all these data at very detailed levels of individual components, we're going to be making false promises, I think, to the public. Because we collect it, we can collect. We can keep collecting and collecting and collecting. But if we can't publish it, then I think that's disingenuous? I don't know. Whatever it is, it's not constructive in my personal view. Okay, so my second point was this is a minimum standard for comparability, but it's not prohibitive of more detail being collected when an agency demonstrates that it's useful to do so. I said I was going to mention the word utility, practical utility, and I will do that. One of the things that we continue to look at is balancing the burden that we impose on people against the use that will be made of the information. So it really is incumbent on those who are seeking information and seeking more detailed information to demonstrate how the information will be used. That's not special for this meeting, by the way. that's the overall process, and it has to do with dollar resources, but it also has to do with the whole issue that I mentioned about the voluntary compliance of the public. The public, frankly, probably doesn't distinguish between all the different federal agencies that are collecting information, nor do I believe that they distinguish very well between our wonderful collections of information by the federal agencies and all the other information collections that come to their landlines or their cell phones or wherever they're coming to these days that may or may not have the same ultimate uses in terms of distribution of funds or improving educational programs or whatever we want to call them. So we have to be very careful with how much burden that we add to the public's perception of what we're asking for. So that burden, practical utility thing, balancing, I do that a lot, I would underscore. If I had some recommendations, I don't know if I was asked to make recommendations, I would say, first off, and importantly, please talk to the agencies. Now, Tom Nardone was good enough to raise his hand way in the back, and now I can see his face. But there will be people with you, or they're here already, from a number of the other agencies. There's census folks here. Tom's from BLS. There may be more with him. I'm not sure. Folks will be here, are here from the National Center for Education Statistics, from the National Center for Health Statistics. I know they had a conflict today, but they're going to be with you tomorrow. And so on. And I encourage you to talk to those people, because these are the folks that you can talk to about oversampling. These are the people you can talk to about combining data over a number of years, about combining data sets. And importantly, these are people you can talk to about gaining access. We do have ways to get you access to microdata. And, you know, you can become, you can become a sworn census employee. That's elaborate. You can go to a research data center, and we're expanding the research data center program as we speak. And it will be more available to people. You don't have to go to the dreaded Suitland in order to take advantage of this capability. Sorry, that's an in-joke for those who have been to Suitland. I go there a lot. So my recommendation, my strongest recommendation, frankly, is that you talk to the individuals who are here and continue these conversations. My second recommendation, I guess, is Bob Groves did talk a little bit about these interagency forums that we have, forums, that are looking across at different sorts of people we would like to paint portraits of, but we don't have a national center on children's statistics. We don't have a national center on aging statistics. We don't have a national center on women's statistics. I'm not sure we should, okay? But what we do need to do is give people a lens, a way to find out what information sources are available if their interest is in a particular group within the population, whether it's a racial ethnic group or an age group or a gender group or whatever. We can do this. We know how to do it. It does take resources to do it. The data exists, but bringing them together, making a publication, standardizing the way we're presenting the information so people aren't confused when we have different scales on the data and so on, that takes resources, but it can be done because we've proven we know how to do it. And so if that's something to be discussed further, you know, maybe that's something to be talked about. Advisory structures, I was just kind of laughing because I was thinking about when they were talking about redistricting. There's a former census director, there's not very many people who are as old as me in this room, but there's a former census director who was named Vince Baraba, and he was known to a lot of people because he actually was called twice to direct the census, once by each administration, which was interesting. But leading up to the 80 census, Vince convened, to the best of my knowledge, for the first time in the departmental auditorium at the Department of Commerce, representatives from every racial and ethnic group that he could think of. And he sat up on the stage and listened for hours. It was unbelievable. I mean, I was in the audience, and I just had to really admire what he did. But I think it led to, in some measure, it led to the formation of the racial and ethnic advisory committees that Bob Groves had mentioned this morning, to have a more consistent and orderly and discussion. I am not aware of any of the other agencies having something similar to these WHIAAPI committees. If they have them, I don't know about them, and that some of them do have advisory committees or technical advisory groups or something. We have issues sometimes about the word advisory committee, but you know, that's another area that people may want to think about, talking to agencies about how to have a better presence or a more meaningful presence or whatever. I need to finish the story about Vince by saying that I recently was asked to help him out a little bit. Bob said that he would never want to be involved in redistricting, but Vince Baraba is going to be one of the public members of the California Redistricting Commission for this round of the census. So for those who know Vince, this is a particularly amusing moment. Then please do think about, this is not a recommendation, but please do keep in mind this collection versus, I'll call it publication. That's an old-fashioned word, but the ability to collect is one thing. The ability to make it available to users is something else, and we need to keep that in mind. I think that's most of what I wanted to say. So I will take questions if there are questions.
I'm sure there will be a lot of questions. So just to let folks know, we'll just go over a few minutes, and that just means you have to run and get your lunch and come back. So do you have our microphones up? Our staff can help. Yeah. So Priscilla, why don't you go ahead? And if you could keep your questions short, we can get longer answers.
And since I don't know the people in the room, it really was helpful this morning when people identified themselves.
Great. Thanks so much. I'm Priscilla. I'm with the Asian and Pacific Islander American Health Forum. And I had a question for all the panelists, but perhaps Dr. Islam in particular. I thought the statistics about cellular use were really interesting. And with the movement through the Affordable Care Act and through ARA towards, building a health IT infrastructure and kind of, putting everything, electronic patient records and everything online, and to encourage people to enroll and to do all of that eligibility processes online. I'm wondering if there's similar research or data or information about internet use within our communities.
There are a few surveys that have looked at computer internet access and usage. I think it's in the current population survey. Clearly, one of the big problems is that current population survey sample is not huge, so we get into issues about subpopulations. There's ongoing research, individual at different sites, doing surveys about access to internet and access to computers. One of my graduate students right now is doing a specialized survey among Japanese American, particularly elderly Japanese Americans, who actually has one of the lowest usage and access to computers and internet. So yes, there's work being done. There's much more work that needs to be done. How it might be related to data collection is that there is a movement to put surveys on the internet. Survey Monkey and all these other sort of things. And I think we're just beginning to understand both the potential and limitations of that approach. So there's some research where we're piggybacking both traditional surveys, telephone-based surveys, and we actually have made progress in terms of dealing with the cellular phone, in terms of telephone-based surveys, but piggybacking that on top of a parallel survey where we do on the internet, because we really need to do basic research in terms of these different methodologies, both their potential and limitations, particularly as they apply to Asian and Pacific Americans. So work's being done, but much more work needs to be done.
I'm sorry.
We have collected information on internet use in some of the local studies that we've done, and we found varying rates. It tends to be by age. So we have found among younger Asian populations, there's higher use of the internet, older, much less. In terms of implications for, we use a lot of this data as formative research to inform intervention studies or intervention research. And so, for example, in our hepatitis B work, we're developing a social marketing campaign. So clearly the use of internet might be a great vehicle in terms of targeting younger Asian American community members.
Okay. Lisa?
I just had a question for OMB. Lisa Hasegawa, National Capacity. Is there any precedence for having different levels of data collection standards for different states? Like in a rural context, or I don't know what the other analogy is, but I was just wondering if there was any kind of model like that. Because I think one thing that, I've put out there before and might be interesting to consider is whether or not we could have different kind of relationship or requirements for federal programs that are in like the states that have the largest API population. So I was just wondering if there was another analogous sort of framework for other sorts of issues or special populations. Thanks.
Without being able to give you a specific site here, although I could probably back at the office, I can say with reasonable confidence that we do have in some of our information collections, and they could be both in surveys and in some of the administrative collections, I think, precedents for more detailed collection of specific racial and ethnic information in a particular set of states where there's a preponderance of a population, whatever. I think that precedent can be demonstrated, and that those who did it demonstrated the practical utility. I'm sorry to sound like a whatever you call it, broken record. Must be some new expression for that too. But I think yes is the answer to your question.
Hi, Kathy Aloha Maile Tawali'i, Director of the Native Hawaiian Epidemiology Center at Papaololokahi. Thank you for coming. We really appreciate it.
Thank you for coming. You've come a long way.
I did. 12-hour flight. There's a few of us who made it. I was curious. You folks have done a great job at making sure that the mandate is in place for the separation of Native Hawaiian and Pacific Islander data. Yet when we get access to the data files, and we have been able to through Vital Statistics, and the folks, Ed Sondick and his crew have been very helpful in getting us access. But when we look at the data and start to pull it down and look at the granularity, within the Native Hawaiian Pacific Islander category is a category that's titled Other Asian Pacific Islander. And it's really difficult because it's within the Native Hawaiian.
Oh, really?
There is. And it's a very large category, actually. Every state that is recording Native Hawaiian and Pacific Islander is within that category, putting quite a bit of people into the Other Asian Pacific Islander category, which is a subcategory within the Native Hawaiian Pacific Islander data. So when we present, now that we have access, now that we are working in partnership with our federal partners, now that we have built the informatic tools in order to analyze 7 million plus data points and actually do it with statistical confidence, we still run into the problem where we can't, with confidence, release data on Native Hawaiians and Pacific Islanders because the data for that category actually still includes a very substantial Asian category, but we don't actually know how many are Asian and how many are Pacific Islander. And I think both the Asian population as well as the Native Hawaiian Pacific population really needs to have a clear separation when we're trying to do that work. So is there a way that you might be able to help us address that other Asian
I would be
PI?
delighted to help you address it. And as you know better than I do, or as well as I do in any event, a lot of that probably was driven by the Association for Vital Records, whatever it's called, and the state registrars coming to consensus on what is ultimately a state form, not a federal form. But we need to approach this. I had no idea until you mentioned it, so that's the first step right there.
We're working with folks at Vital Statistics to show that category.
Yeah.
We'll be producing findings that we'll give directly to them first so that they can help us maybe find out ways that we can respectfully work with the states to clarify between that.
I think that's great. There is there anyone from NCHS who was able to be here today? Probably not.
Oh, here.
I can't see.
Someone is here.
Oh, hi. Is that Jack? Yes. Hi. How
See,
are
she
ya?
knows everyone.
Well, no, but Jackie was actually, Bob was singling out people who deserve credit for the 2010 census back home. Jackie was one of the ones who worked with us on the standards when we were doing our work back in the 90s, right? Right. But I would mention there is a board of scientific counselors that advises NCHS, and I sit ex officio on that, so I get to go. But maybe, there is someone from the Vital Records, actually there's a couple people from the Vital Records constituency who are members of that. So it seems to me if you could do your data, the data's worth 1,000 anecdotes, right? Okay, if you could do your data, get it into the Vital Records people, maybe we can get it on that agenda. Or there are other ways that we can probably pursue, but I think that would be reasonable. We'll send you a report. Please do. Yes, and to Jackie, please. Thank you.
Great. Thank you so much. I'd like to take this time to thank our panelists. And I encourage you to continue the discussion. We have about 15 minutes to get your lunch and come back, and we have administration officials to join us.